Dee has some bags under her eyes, and traditionally the way of dealing with these would be a lower eyelid surgery, which involves making an incision under the eye, going in, taking out some of this fat, tightening the muscle, and trimming the skin. And for a lot of people, that is still the most appropriate option. But sometimes a lot of people don't feel ready for surgery, they don't want to have surgery, and in those situations, we can help using some filler. It's not quite a tear trough filler in this case, because filling the tear trough on its own is not really going to do much other than make this area look quite bulky. So what we need to do in a situation like this is correct the volume loss in the cheek first so that we get a bit of lift, and then use some filler into the junction between the lower eyelid and the cheek to help camouflage the appearance of the bag. So this isn't going to get rid of the bags completely, but it's going to give us a really nice improvement without surgery. Okay, so we're going to start with the cheek. Okay, so I'm going to give you some nice lateral projection. So we're getting some width to the face, which helps us to expand the cheek back. And that stretches the eyelid a little bit. You all right? Mm-hmm. Good. Just bring everything down. Okay. Okay, just turn them slightly. So all I've done so far is fill the lateral part of the cheek. I haven't come into the middle part of the cheek yet, but you can already see that the bag on this side is starting to look less prominent than on that side. And at this stage, all we've done is really fill back here, so we get that little bit of lateral pull here. So next I'm going to move into this middle section of the cheek, and then finally we're going to go up under the eye. Okay. So we've now supported the lateral and the medial cheek, and you can see that just by supporting the cheek, it's already started to push the lower eyelid back up. You can already see that it's started to improve the appearance of the bag in this side compared with that side before we've even done anything to the eyelid itself. So this is purely the effect of filling the cheek first so that it gives us that nice lift. Now that we've supported the eyelid from below in the cheek, I'm coming into the eyelid itself. And I'm gonna just blend the junction between the eyelid and the cheek. Now the important thing here is that we don't want to overdo this, okay? So we're never gonna get rid of the bag completely, so we shouldn't try to, because if you do try and push it too far, you end up just making the lower eyelid look puffy, which is not a good. So, So this is the effect that we can achieve. So this is the side that we've treated compared with the side that we've not treated. So you can see that the bag's not gone completely, but on this side it's much softer than it is on that side. And this is immediately afterwards when it's just been done. So it will get better as the filler gets a chance to settle in. Okay. Okay, and then insert forward again. Thank you. Good. And there we go.
This makes amazing.
All right.
Wow. Wow.
Okay.
Great.